Hey guys, it's Sunday morning. I'm here with Dr. Bock at Vail Health. Dr. Bock is the CEO of Colorado Mountain Medical. He has also been leading the effort with many of us over the past month to respond to COVID. So I wanted to bring him on and give him the ability to tell some of the great things that we have going on. Dr. Bock, can you tell us a little bit about everything Colorado Mountain Medical is doing and also how it integrates with Vail Health and how that family is working?
Sure, happy to do that. Well, it's a remarkable system that we've created that has allowed us to put in place 3 levels of care for the patients here in Eagle County. And I'll start with the level of care in Gypsum, where we've created at the former Gypsum Urgent Care Center a COVID-19 testing facility that is a drive-through facility where you can get tested for flu, for strep if you should have a sore throat, and then for COVID-19, and everyone has a COVID-19 test sent from that facility. And when I say drive-through, I mean you sit in your car, people come out to your car and test you. There's a swab that is placed in your nose, and that's how the specimen is obtained. To be able to get testing at that facility, you need to call either a Colorado Mountain Medical office, Mountain Family Health Center office, or the Vail Health Avon Urgent Care Center and be screened. And if you meet the criteria, which are quite broad at this point in time, they include things that we had established early on, like fever, cough, particularly a dry cough, shortness of breath, but now it's expanded to include headache, earache, sore throat, loss of sense of smell or taste. We are looking at people who have had abdominal pain, nausea, vomiting, diarrhea. All of those criteria would fit into appropriate testing criteria for COVID-19. So if you're screened positive, then the person who has screened you will send your contact information to an email address, and you'll receive a call. And a specific time will be identified for you to be tested, and you just need to show up and be tested at that point in time. If you don't have health insurance and you're concerned about cost, if you're uninsured and unable to pay, the testing will be done for free. So it's a very comprehensive testing facility. That has been added to by having several respiratory clinics. And we have those respiratory clinics in Eagle, at the Colorado Mountain Medical office at the Eagle Healthcare Center. We have one in Avon at the Vail Health Avon Urgent Care, which is near the City Market in Avon. And then we have one in Vail at the Medical Professional Building, which is immediately next to the hospital. And those facilities are for folks who are more significantly ill and are going to need, in addition potentially to testing, they're going to need an evaluation by a physician or a mid-level provider. And you would call one of those offices, along with Mountain Family as well, which is in Edwards. And you would make an appointment and you'll be seen. And if you need testing, you'll be tested. You needn't be frightened by the fact that you'll be met at the door with someone who will give you a mask. And anyone who might have come with you will be given a mask. In fact, we might even ask that that person wait in the car as opposed to coming in, because proximity to individuals who are sick is how this virus is transmitted, and it's a very, very deadly virus, and we don't want people who don't need to be exposed. And then the third level of care, and very importantly, a critical level of care, is the emergency department at the hospital, where the most severely ill and injured, should someone become injured during this period of time, patients would come and be evaluated. So there's testing in all of those places. There is an evaluation available in either the respiratory clinics or in the emergency department, and should you need admission to the hospital, that is usually expedited through the emergency department, although if someone were to be seen in a respiratory clinic and need a direct admission, that can be performed as well.
So 2 follow-up questions. So one thing that I've heard you say again and again, we want the public to know is if you are sick, you need to contact your primary care provider and they will assess you and we can do tests right across all of your locations today.
That's absolutely correct.
Right, so that's one message.
And we
we wanted to
broadened
have.
the criteria, as I mentioned.
Thank you. And then the other thing is this unique relationship with Colorado Mountain Medical, being out in the community with the community health, seeing what's going on in partnership with Vail Health, which is really the hospital and the ED. Tell us how that's been benefiting us as we respond to this event.
Well, we sit in the same room every day planning for how we're going to respond as a healthcare system, and we, Colorado Mountain Medical, are a part of Vail Health at this point in time. We are partners. Everything is done in a coordinated fashion. We talk about it, we plan, and then we enact whatever we're going to enact. So the partnership has been key to being able to put in place a system that I think is providing testing and very good care for our patient population. And I think that will serve us not only through this coronavirus COVID-19 pandemic, but into the future for healthcare in this community. There's one other thing I might mention, and that has to do with the Mira bus. And the Mira bus is a bus that travels to the Latinx Hispanic community in Avon, at the Aspens, in Edwards, the trailer park there, and in Dotsero as well, the trailer park there. And beginning tomorrow, we're going to be doing testing for COVID-19 out of that bus 3 days a week. Tomorrow we start at the Aspens in Avon, and then on Wednesday we'll be at the trailer park in Edwards, and on Friday at the trailer park in Dotsero. And again, if there is a phone number that is available that you would call and make an appointment for that, you would be screened on that phone call, and then you'll be given an appointment time. And we certainly want people who are either going to the gypsum facility or to the Mira bus in one of those locations to keep in mind that time, because it's important that we keep people separated from one another. We don't want a line of people forming. We want people basically at least 6 feet apart from each other, and they would have an appointment for testing, and that service at the Mira bus is free to whomever has an appointment made and comes and is tested.
And before we wrap up, I just want to publicly thank Dr. Bock. I think today is day 30 straight of coming in every morning and leading us going forward. So thank you from all of us for everything you and your organization is doing. We
Thanks
appreciate
very much, Chris.
Thank you.
We appreciate it.
Thank you.